Hello, future nurses. Today we're covering hepatitis, a key topic for your exams and your career. Hepatitis means inflammation of the liver, a vital organ responsible for detoxifying blood and aiding digestion. There are 5 main types: A, B, C, D, and E. A and E spread via contaminated food or water. Remember, vowels for bowels. B, C, and D spread through blood and body fluids. Hepatitis A is always acute and has a vaccine. B can be acute or chronic and also has a vaccine. C is most likely to become chronic and has no vaccine. D only infects those with B. E is usually acute, no vaccine, and dangerous for pregnant women. As nurses, you'll assess risk factors, recent travel, food exposure, or blood contact, to identify the likely type. This knowledge guides your questions, anticipates doctor's orders, and shapes patient education. Mastering these basics is your foundation for safe, effective care. Let's move on to recognizing the signs and tests for hepatitis. Hepatitis often starts with flu-like symptoms: fatigue, nausea, loss of appetite, and abdominal pain. Classic signs include jaundice, yellow skin, eyes, dark urine, and pale stools. Signals the liver isn't processing bilirubin. Hepatitis B and C can be silent for years, causing damage without symptoms, so screening high-risk groups is vital. By the time severe symptoms appear, liver damage may already be advanced. Diagnosis relies on liver function tests, LFTs, especially ALT and AST, and bilirubin levels. Serology tests identify the specific virus by detecting antigens and antibodies. Early detection is key to preventing complications. As nurses, you'll monitor symptoms and lab results closely. Next, let's look at treatment and nursing care. Treatment depends on the type and whether it's acute or chronic. For acute hepatitis A and E, care is supportive: rest, hydration, and nutrition. Chronic hepatitis B may require antivirals to suppress the virus and prevent liver damage. Hepatitis C is now curable in most cases with direct-acting antivirals. All patients must avoid alcohol and be cautious with medications. Many are processed by the liver. Nurses play a central role: monitor symptoms, track labs, and educate patients on medication adherence and lifestyle changes. Teach infection control: hand washing for A and E, safe sex, and no needle sharing for B, C, and D. Patient education is your most powerful tool. Now let's cover complications and quick NCLEX tips. Untreated chronic hepatitis B and C can cause fibrosis, cirrhosis, liver failure, and liver cancer. Regular screening, ultrasound, and blood tests is essential for early detection of complications. Remember, vowels for bowels for A and E transmission. B, C, and D are bloodborne. Vaccines exist for A, and BC is chronic and has no vaccine. D depends on B. For NCLEX, focus on prevention: hand washing, safe food, water, safe sex, no needle sharing, and vaccination. Always stress avoiding alcohol and hepatotoxic drugs. Think hepatitis when you see jaundice and dark urine in a question. Master these essentials and you'll be ready for both patient care and your exams.